Our last lecture will focus on evaluation models and how they are designed, the barriers to evaluation, and how to analyze and interpret data collected from evaluations. Guidelines for reporting results of evaluations is the last area we will highlight in this lesson. Evaluation means to gather, summarize, interpret, and use data to see if a particular action was effective or not, and the steps include focus, including evaluation models used, designing the evaluation, conducting the evaluation, determining methods to analyze and interpret the data collected, reporting the findings of this data, and using the evaluation process to guide future action planning and carrying out interventions. Evaluations tend to be very specific, whereas evidence-based practice, or EBP, is used more broadly in decision-making processes. It uses the most relevant and best research, one's own clinical expertise, and patient preferences and values, and integrates them into a clinical practice. Evidence-based medicine includes those three determinants and adds patient circumstances. Practice-based medicine, PBE, is defined as the systematic collection of data about client progress generated during treatment to enhance the quality and outcomes of care. The difference between evaluation and assessment is that assessment focuses initially on gathering, summarizing, interpreting, and using data to decide a direction for action, whereas evaluation is the gathering, summarizing, interpreting, and using data after an activity has been completed to determine if the action was successful. The first step in planning an evaluation is focus. It is also the most crucial step and involves 5 basic components. 1. Audience, which includes the group for whom the evaluation is being conducted, or the primary audience, and the general audience, who are all those who might benefit from the evaluation's findings. 2. The purpose, which answers the question, why is this evaluation being conducted? This is not the same as who or what is being evaluated. 3. Questions, which are related to the purpose and must be specific and yield measurable answers. 4. Scope, which answers how much will be evaluated. For example, how many people, for how long, and for what particular skill. And lastly, 5. Resources, which include time, expertise, personnel, materials, equipment, and facilities. There are many evaluation models, and we will cover several here. The first is the Roberta Strassel-Abrazoszeze, or RSA model, for classifying types of educational evaluations into different levels. The levels are from the simplest process evaluation to the most complex impact evaluation, and all of them are used to develop a total program evaluation. In the process evaluation, also known as formative evaluation, the purpose is to make adjustments to the educational plan as soon as needed and involves the individual educator. Adjustments are made frequently and at low expense. In content evaluation, the educator-clinician can be an individual or part of a team, and the purpose is to determine whether the learners have acquired the necessary skills or knowledge that was taught and to what degree objectives were met. Outcome evaluation looks at the education team, or the director of funding group, to determine what goals were met and if behavior changes occurred. It is broader and longer term in scope and is relatively expensive and requires expertise. Impact evaluations are used to decide whether continuing an educational activity is worth the cost based on the effect it has on the institution or the community. For instance, what is the impact of COPD disease management on rehospitalization of COPD patients? It is often broadly focused, complex, and resource intensive. The purpose of the total program evaluation is to determine the extent to which all activities for an entire department or program over a specified period of time meet or exceed the goals originally established. The scope encompasses all aspects of educational activities previously mentioned. Rankin and Stallings developed a model that looked at 5 levels of learner evaluations, where 0 represents an acute need or readiness to learn, all the way to 5, where the learner has maintained performance or attitude of the original objective. For all evaluation tools, keep in mind that evaluations are not the same as research, as evaluations generally are used to make decisions in a specific setting. The first element in an evaluation are the types of data to be collected, such as patient data, including demographics, cognitive, affective, and/or psychomotor behaviors, the program data, such as cost, length of activity or program, number of educators required, teaching learning methods, etc., and environmental data such as temperature, layout, space, and noise level. From whom this data will be collected is the next question to answer. How, when, and where the data will be collected may include observation, interviews, questionnaires, and tests, and who collects the data could be the learner, educator, evaluator, or trained data collector. Minimizing bias in data collection should also be considered. Barriers to evaluations generally fall into three categories. 1. Lack of clarity, which can be overcome with a clearly stated purpose and focus. 2. Lack of ability, which can be improved by making resources available and enlisting others' expertise. Or 3. Fear of punishment or loss of self-esteem, which can be improved by identifying and resolving fears among those being evaluated and focusing on data without personalizing or blaming, and providing encouragement and positive feedback. When choosing evaluation instruments, you may not need to reinvent the wheel, as many instruments are readily available with a little research. If you conduct your own, make sure you conduct a pilot test first to make sure the evaluation instrument is reliable and valid, and be prepared for things to go not as planned. Always keep a sense of humor. When collecting data, it must be organized into understandable tables, graphs, or categories relevant to the evaluation's purpose. This data may be quantitative or qualitative in nature. When reporting your evaluation results, start with an executive summary. Keep the language simple, give handouts, and provide specific recommendations based on your evaluations. Don't forget to present any limitations to your evaluations, which might include patient understanding of directions included in the evaluation, and are ways in which you might improve your evaluation instrument in the future. Although all aspects of an evaluation are important, the most important aspect is that it is actually used to plan, carry out, and improve your education interventions. Thank you again for being an awesome audience. Hope you have learned as much as I have.